if your urine has turned cloudy, dark, reddish, or even looks foamy. This is not something you should ignore, especially if you're a man over 60. Because changes in urine color can be one of the earliest and most overlooked warning signs of prostate trouble. And I say this not to scare you, but to protect you. I've seen men brush off these signs, thinking it's just dehydration or nothing at all, only to find out months later that their prostate was enlarged, inflamed, or worse. My name is Dr. Mohit Kara. I'm a men's health specialist and professor of urology, with over 30 years of experience helping men take control of their health, energy, and confidence, especially as they age. I've worked with thousands of older men, and I've learned one undeniable truth. When the body whispers, we must listen before it starts to scream. Here's something most men don't realize. The prostate sits directly below the bladder and wraps around the urethra the tube urine passes through. So, when your urine changes in color, smell, or flow, your prostate could be involved. But which colors matter, and when should you be concerned? That's exactly what we're going to uncover today. In this video, I'll walk you through the 5 urine colors that may be warning you about prostate issues and what each one means. You'll also learn a simple 10-second test you can do at home, and what natural steps you can take starting tonight to protect your health, your independence, and your future. And make sure you stay until the end, because the most dangerous color of all is the one most men completely overlook. Let's get started. Before we dive in, if you care about protecting your prostate and staying healthy after 60, make sure to hit that subscribe button and turn on the bell so you never miss important health advice tailored just for you. And if this video helps you understand your body better, type 1 in the comments. Not type 0. Your feedback helps them serve you better. Alright, now let's talk about what your urine is really telling you. Because the truth is, urine isn't just waste. It's a signal. And for men over 60, it can reveal what's going on deep inside your prostate long before you feel any pain or notice other symptoms. What your urine color is trying to tell you. What your urine color is trying to tell you. I've been practicing urology for over 3 decades now, and there's something I wish more men understood, especially those over 60. Your urine is not just something your body gets rid of. It's a message, a reflection of what's going on inside your body. More specifically, it can be a powerful early warning signal from your prostate. I remember one patient in particular, a retired firefighter named James. Strong guy, worked hard all his life. He came into my clinic complaining about frequent nighttime trips to the bathroom. But what really caught my attention was something he almost didn't mention at all. His urine had been looking a little off lately. It's kind of dark and cloudy, he said casually, almost like it wasn't worth bringing up. But to me, that was the most important part of the visit. You see, the prostate sits just below your bladder and surrounds the urethra. The very tube urine flows through. So when the prostate becomes enlarged, inflamed, or infected, urine is often the first thing to change, long before pain, long before sexual dysfunction, long before real damage sets in. Sometimes the stream becomes weaker. Sometimes the color darkens. Sometimes it becomes cloudy, foamy, or even reddish. These aren't random changes. They're the prostate trying to speak up, trying to tell you that something's off. And the heartbreaking part, most men ignore it. They assume it's just dehydration or something they ate, or they don't even look. They flush and move on. But the truth is, your urine can offer some of the earliest clues that your prostate needs attention. By the time pain or other symptoms show up, the situation is often much more advanced. That's why I always tell my patients, don't wait for the discomfort. Learn to read the signs early. Your body's talking. You just have to listen. And what are those signs exactly? What specific urine colors should you be watching for? And what might each one be saying about your prostate? This is where things get eye-opening, because each color tells a different story. And some of those stories are more dangerous than Thor's. Let's look at the first one together. One that most men write off but could be the start of something serious too. Cloudy or milky urine. I'll never forget the first time I saw cloudy or milky urinite in my own father. He was in his early 70s, still sharp as ever, still active. But one evening, he mentioned something casually over dinner. "My urine's been looking kinda cloudy lately," he said, just like that. No concern, no urgency, just an observation. I froze for a second because I knew what that could mean. And I also knew he probably didn't. Cloudy or milky urine might not sound alarming at first. It doesn't burn, it doesn't hurt. It's easy to dismiss Bhutan men over 60. It's a warning you should never ignore. That cloudy appearance can be a sign of inflammation. And when the prostate becomes inflamed, a condition known as prostatitis, it often sends out signals through the urine before anything else. That cloudiness is sometimes caused by white blood cells, pus, or even tiny protein clumps that your body releases in response to infection or irritation in the prostate. I've seen many men come in for unrelated reasons: trouble sleeping, low energy, even back pain. And when I ask them about their urine, they'll pause and say, "Now that you mention it, it has looked kind of cloudy." That's usually when I start paying closer attention. In older men, prostatitis can sneak in quietly. There's often no fever, no intense pain, just a few subtle signs, and cloudy urine is usually one of the first. Left unchecked, this inflammation can start to affect urinary flow, lead to discomfort in the pelvic area, and in some cases trigger more serious complications like urinary retention or chronic bacterial infections. One of my patients, Ron, told me he thought his cloudy urine was just due to something he ate. He waited months before saying anything. By then, his prostate was so inflamed he could barely urinate without discomfort. Thankfully, with proper care, we managed to reverse the inflammation, but it didn't have to get that far. I often say this to my patients, and I'll say it to you now: if your urine looks cloudy for more than a couple of days, don't assume. Don't guess. Take it seriously, especially if it's paired with other signs like frequent urination, a weak stream, or a fever you didn't fully empty your bladder. Our bodies speak to us in whisper spore. They scream. And cloudy urine is one of those quiet whispers that deserves our full attention. But as strange as cloudy urine might seem, it's not the only one sending warning signals. There's another color that looks completely different, darker, richer, and often mistaken for something harmless when in fact it could be hiding something much more serious. Let's talk about that next. 3. Dark amber or brown dot. Dark amber or brown. A few years ago, a gentleman named Harold came to see me. Quito Queen Pry recently retired and finally starting to enjoy the slower pace of life. It'd always been the type who avoided doctors unless absolutely necessary. But these times something had unnerved him. His urine had started turning a dark, almost steel-like color. "I figured it was just something I ate," he said. "Or maybe I wasn't drinking enough water." That's what most men think. They notice their urine turning amber or even brown and they chalk it up to dehydration. And yes, sometimes it is. But in men over 60, we have to dig deeper because when your prostate begins to swell or compress the urinary tract, pressure builds. That pressure can cause tiny blood vessels to rupture, releasing small amounts of blood into the urine. And when blood sits in urine for even a short time, it darkens. What starts as a light pink tinge can quickly become amber or brown. Harold didn't have any pain, no burning, no urgency, nothing alarming, just that dark color. But I ordered a few tests just to be safe. It turned out his prostate had become significantly young, and the pressure was not only affecting his urinary system, which was beginning to strain his bladder as well. He had no idea that color change was his only clue. And thank God he listened to it. This kind of dark urine doesn't always mean bleeding. Sometimes it's your liver or kidneys struggling to clear waste. But in older men, especially those with any signs of BPH, benign prostatic purpleus, it's often tied directly to changes in the prostate. When the flow of urine is slowed or blocked, toxins linger longer. The urine becomes more concentrated. It darkens, and the body starts sending a signal. What I want you to understand is that this color shift doesn't need to come with pain to be dangerous. The absence of pain doesn't mean the absence of a problem. Your body isn't always dramatic about how it warns you. Sometimes it's subtle, almost easy to miss, but that's when we need to pay even closer attention. If your urine starts to look like weak tea, or you notice a darker, thicker color for more than a couple of days, especially if you're drinking plenty of water, don't ignore it. It could be your prostate, and it could be the only warning it gives you. And while dark urine can be unsettling, there's another sign that's even more alarming because it's often mistaken for something far more dangerous. When a man sees red in the toilet bowl, it sparks a very different kind of fear. But the real story behind reddish or pinkish urine isn't always what you think. Let's talk about that next. 4. Reddish or pinkish urine. Reddish or pinkish urine, there's a certain moment no man forgets. Standing at the toilet, looking down and seeing red. It's a jolt, a rush of confusion, fear, denial. I remember one of my longtime patients, Michael, calling me late one evening. He was 72, a widower, and lived alone. His voice was trembling. "Doc, there's blood in my urine." He said, "I don't know what's happening, but I'm scared." Honestly, he had every right to be. Seeing even the faintest trace of red or pink in your urine can be terrifying. Our minds race to the worst case scenario. Cancer, internal bleeding, something catastrophic. But the truth is, while reddish or pinkish urine always warrants attention, it doesn't always mean something life-threatening. Still, in men over 60, it can be a serious signal, especially when it comes from the prostate. The prostate is wrapped tightly around the urethra and sits just below the bladder. As it enlarges, it can compress blood vessels, causing microscopic tears or leaks. Even a minor rupture can release enough blood to tint your urine pink or red. This is particularly common when the prostate is inflamed or overly congested, and sometimes the bleeding comes and goes. It might disappear for days, and then return suddenly. That inconsistency leads many men to brush it off. In Michael's case, we ran tests immediately. Thankfully, it wasn't cancer, but it was an early-stage case of benign prostatic hyperplasia. And the pressure his prostate was putting on his urinary tract had already begun to affect his kidney function. We caught idly, but only because he listened to his fear instead of ignoring it. Blood in the urine, no matter how light or sporadic, is never normal. It's your body waving a red flag. And while it might not always be the prostate, it very often is, especially if you're over 60 and already experiencing other subtle symptoms, like weak flow or frequent nighttime trips to the bathroom. The key here is to notice, to not dismiss it. I've seen too many men chalk it up to something they ate. Beets, vitamins, medications, when in reality it was their prostate trying to speak up. And while reddish urine grabs your attention, there's another signal that often slips under the radar. It's quieter, subtler, but just as important. In fact, many men confuse it with normal aging or assume it's harmless. But when your urine turns deep yellow or orange, your prostate might be struggling more than you think. Let's take a closer look at that next dot, very dark yellow or orange 5. It's very dark yellow or orange. A few months ago, a patient named Roger walked into my office. He was 74, sharp-witted, and proud of the fact that he'd never needed any serious medical care. "Doc," he said, chuckling a little, "my urine's been looking like orange whisk lately. Is that something I should be worried about?" He was joking, but I could hear the uncertainty underneath. And yes, he absolutely should have been concerned. Most men know that dark yellow urine might mean they're dehydrated. That's usually the go-to explanation. And often, it's true. But when I hear an older man say his urine is consistently dark yellow or even orange, especially if he's been drinking enough water, it raises a different set of questions. Because when you're over 60 and your prostate begins to grow or swell, it can interfere with the bladder's ability to fully empty. And when that happens, urine sits longer in the body. It becomes more concentrated. The waste products build up, and that's when you start seeing that deeper, darker color. But here's what most men miss. This isn't just about hydration. This is about how well your body is clearing toxins. When your urine is consistently very dark yellow or orange despite good hydration, it could mean your urinary system is under stress. Your bladder may be retaining urine. Your kidneys might be working harder than they should. Then your prostate could be part of the problem. I remember reviewing Roger's scans. His bladder wasn't emptying properly, and his prostate was significantly enlarged. Enough to obstruct flow, but not enough to trigger major symptoms yet. He had no pain, no urgency, no weak stream, just orange-colored urine. But that was the clue that helped us catch his condition early before it affected his kidneys or his quality of life. This is why I urge older men not toying your subtle shifts. You don't need dramatic pain or discomfort for something to be wrong. Sometimes stability whispers through color, through the things we see but often dismiss. And that color can be trying to tell our prostate is struggling. So if you're noticing a persistent deppy yellow or orange hue in your urine, and you know you're staying hydrated, don't brush it off. It might be more than just what you're drinking. Could be a sign your urinary system is under pressure and your prostate is playing a bigger role than you realize. But among all these warning signs, there's one that's perhaps the most easily overlooked and the most misunderstood. Many men see it, think it's normal, and move on. But foamy, bubbly urine could be pointing to something far more serious than it seems. Let's talk about that next. 6. Foamy or bubbly urine. Foamy or bubbly urine, a few years back, had a patient named Samuel. He was 66, recently retired, and proud of his clean bill of health. He told me he had no real complaints, no pain, no trouble. Urinating, nothing gunial. But then, just as he was about to leave the exam room, he paused and said, "Actually, there's one thing. Urine's been looking kind of foamy lately. Is that normal?" It almost didn't bring it up. And that's what stuck with me, because what he thought was nothing, just some bubbles, turned out to be a sign of something far more important. Foamy or bubbly urine is often brushed aside. It doesn't look like blood, it doesn't hurt, and it doesn't always change the way you feel. But in men over 60, it can be a quiet sign that your body is under stress. And sometimes your prostate is part of that picture. KWZ, when your prostate becomes enlarged, it can cause incomplete emptying of the bladder. That left ovarian sits, stagnates, and increases the concentration of proteins in the urinary tract. When those proteins are passed, they can cause that distinct foamy appearance in the toilet bowl. Now, in some cases, foamy urine can also point to issues with the kidneys. It can indicate protein leakage, a condition called proteinuria. And while that might seem unrelated to the prostate at first glance, the two are more connected than most people realize. When your bladder isn't emptying well due to prostate obstruction, pressure can build up and start to affect your kidneys. It's a chain reaction, starting with something as simple as an enlarged prostate and ending with long-term kidney strain. In Samuel's case, further testing showed both mild kidney stress and moderate breast enlargement. He had no classic symptoms, no pain, no urgency, just foam. But that foam told us everything we needed to know to step in before things progressed. So, if you've noticed that your urine looks unusually bubbly or foamy, especially if it lingers on the surface after you flush, don't ignore it, especially if you're not eating a high-protein diet or taking supplements that might cause it. Your body could be trying to release something it can't filter properly. And your prostate may be the reason it's struggling. Men often wait for dramatic signs before they act. But health isn't always dramatic. Sometimes it's quiet. Sometimes it's just bubbles in the water. And sometimes that's enough to change everything if you're paying attention. Now that you know what these 5 urineclers could mean, the next question becomes, what can you do about it? Is there a way to check yourself at home? Put early warning signs before they turn into something worse? The answer is yes. Let me show you a simple challenge that only takes 10 seconds but could change how you see your health forever. The home challenge, what you can check today's. 7. The home challenge, what you can check today. Years ago, I started giving my older patients a simple challenge. It wasn't a blood test. It didn't require a lab, and it took less than a minute. I called it the 10-second urine check. Something every man over 60 can do in the privacy of his own bathroom. And it's helped dozens of my patients catch early warning signs of prostate problems. They spiraled out of control. Here's how it works. The next time you urinate, don't rush. Take just 10 seconds to really look. Not a quick glance. Really look. Notice the color. Notice the clarity. Is it darker than usual? Is there any cloudiness, foam, or even a hint of red or pink? Does the stream start strong and then weaken, or is it interrupted? Do you feel like you emptied fully, or is there still some pressure left behind? These might sound like small things, but to a trained eye, and more importantly, to a concerned man, they can speak volumes. Your urine is a mirror. It reflects what's happening inside your body, especially inside your prostate. As we get older, our bodies don't always shout when something's wrong. Often they whisper. And the only way to hear those whispers is to slow down and pay attention. One of my patients, Dennis, told me that he never thought about his urine until had this conversation. A week later, he noticed his stream was weaker than usual and slightly cloudy. He did that clang again the next morning and saw a reddish tinge he hadn't noticed before. That single moment let him get checked. And we caught early signs of prostatitis before it could do lasting damage. I'm not asking you to be paranoid. I'm asking you to be present because you know your body better than anyone else. And when something changes, even if it seems small, it's your body trying to tell you something. So here's my challenge to you. For the next 3 days, every time you go to the bathroom, take those 10 seconds, observe, reflect, keep mental notes. If anything seems off or stays unusual for more than a couple of days, talk to your doctor. The sooner you catch a problem, the easier it is to fix. But what if you notice something unusual? What comes next? At what point does it move beyond observation and become something that truly needs medical attention? That's what we're going to uncover next, because knowing when to take action could make all the difference in preserving your health and your independence. Let's talk about when it's time to see a doctor. 8. When it's time to see a doctor, there's a moment that comes for almost every man. The moment when you realize something isn't quite right. Maybe it's the 3rd time you've had to get up at night to pee. Maybe it's a weak stream that wasn't there a year ago. Or maybe like one of my longtime patients named Frank. It's that gnawing feeling in your gut telling you this isn't normal anymore. Frank was 70 when he came to see me. He sat down in my office and said, "Doc, I didn't want to waste your time. I'm probably overreacting, but something's changed. My stream is slower. I feel like I never fully empty, and I've been seeing bubbles in my urine for a week now." He looked worried, embarrassed, like he wasn't sure if he was making a big deal out of nothing, but he wasn't. In fact, Frank was doing exactly what I wish more men would do. He was paying attention, and he came in before the situation got worse. You see, the truth is, most men wait too long. They push through the symptoms. They tell themselves it's just age. They don't want to seem dramatic, or they think it'll just fix itself. But telling you wait. The more pressure builds on your bladder, your kidneys, and your quality of life. And when it comes to the prostate, timing matters. So, how do you know when it's time to stop watching and start acting? If your urine has been cloudy, dark, red, or foamy for more than 48 hours, especially if you're well hydrated, that's a sign. If you're waking up more than once per night to urinate, struggling with a weak or intermittent stream, or feeling like, oh, still need to go right after you finished, those are signs. And if any of these changes are accompanied by discomfort, fatigue, or even a sudden drop in sexual performance, your prostate may already be impacting your overall health. There is no shame in getting checked. In fact, I tell my patients that the strongest men are the ones who listen to their bodies and take action early. The truth is, many prostate issues, when caught soon enough, can be managed with simple changes. Medications, supplements, and even lifestyle adjustments can make a world of difference if we intervene early. So, if any of this sounds familiar, don't wait. Don't hope it'll go away on its own. If you're not just protecting your prostate, you're protecting your independence, your sleep, your dignity, and your peace of mind. But here's the part I love most. Because now, after identifying the signs and knowing when to act, we can shift the focus to what you can do starting tonight. Real steps, simple changes, and proven ways to support a healthy prostate naturally. Let's get into that next. What you can do starting tonight 9. What you can do starting tonight. The question I hear most from my patients after we've talked through the signs and the risks is simple. Okay, doc, what do I do now? And I love that question because it tells me they're ready to take control. Not tomorrow, not next week, tonight. One of my patients, Henry, 67, asked me this exact thing during a follow-up visit. He'd been experiencing cloudy urine and a weak stream for a few months. We'd already ruled out infection and confirmed an enlarged prostate, but what struck me most was how determined he was. Just tell me what I can do with them, he said. I want to feel like myself again, and that's the heart of it, isn't it? Most men don't want gimmicks. They don't want to rely on pills forever. They want real, practical steps they can take to support their health on their own terms. And the truth is, you can do a lot more than you think. For starters, pay attention to what's on your plate. Foods rich in lycopene, tomatoes, watermelon, and pink grapefruit can help ease inflammation in the prostate. Cruciferous vegetables, broccoli, cauliflower, Brussels sprouts are also powerful allies. They help balance hormones that, when out of control, can lead to prostate growth. Next, move your body. Just 30 minutes of walking a day can improve blood flow to the pelvic region, reduce inflammation, and support better urinary control. You don't need to hit the gym, just commit to movement. Your prostate will thank you. Hydration is another overlooked key, but here's the trick. Drink plenty of water during the day and then taper off in the evening. That way you stay flushed and clear toxins, but you're not up 3 times a night running to the bathroom. And then there's stress. We don't talk about it enough, but chronic stress ramps up inflammation throughout the body, including in the prostate. Deep breathing, mindfulness, even just spending time doing things you enjoy can help reduce this internal pressure. Your body isn't just a machine. It responds to how you live, how you feel, how you care for yourself. There are also natural supplements worth exploring. Saw palmetto, beta-lactosterol, and pygmium have been shown to ease urinary symptoms in men with mild to moderate prostate enlargement. Futile ways, speak to your doctor before starting anything new. What matters most is consistency. No niaf. These habits will fix things overnight, but done regularly, they can protect your prostate, improve your energy, and help you feel more in control of your body and your life. And if you're thinking all of this sounds good, but maybe it's too late for you, don't. Because what I'm about to share next might change the way you think about aging, your prostate, and what's still possible for you, no matter your age. Let's finish with a truth I think every man needs to hear. 10. The hopeful truth about prostate. Thoughtful truth about prostate health. If you've made it this far, I want to say something directly to you. Not as a doctor, but as someone who deeply respects the journey you're on. Maybe over 60. Maybe you've had a few health scares. Or maybe this is the first time you've really thought about your prostate. Whatever brought you here, I want you to know this. It is not too late. You are not powerless, and you are not alone. You've just learned about the 5 urine colors that may be quietly warning you about prostate problems. Cloudy, dark amber, reddish, orange, and foamy. Each one tells a different story, and each one deserves attention. You now know how the prostate and urinary system are closely connected. How an enlarged or inflamed prostate can affect everything from your stream to your kidneys. You've learned how to pay attention with a simple 10-second home challenge. Understand when it's time to talk to your doctor, and most importantly, you've been given real, doable steps you can take tonight to support your prostate health naturally. That knowledge alone puts you ahead of the curve because most men don't get this information. They ignore the signs. They wait too long. Or worse, they believe that what's happening to their body is just part of getting old and that there's nothing. They can do a booty, but you're different. You're here. You're paying attention, and that changes everything. Do you see? The hopeful truth about prostate health is this. The body responds when you care for it. Seen men in their 60s, 70s even. 80s reverse symptoms, regain confidence, and reclaim their quality of life without surgery. Without long-term medication, and without giving up the things they love. It starts with awareness, and it grows with action. Take what you've learned today and use it. Start by observing your urine without fear, but with curiosity. Make simple changes to your diet, add movement into your daily routine. Learn to breathe a little deeper, sleep a little better, and pay attention to what your body is telling you. Talk to your doctor when something feels off. Don't wait for the pain. Don't wait for crisis. You have more control than you think. If you've been living with symptoms for years, feeling frustrated or discouraged, let me say this with absolute certainty. There is still hope. Healing doesn't always happen overnight, but it does happen. And sometimes it begins with something as simple as a man deciding he's ready to listen to his booty, to the science, and to someone who genuinely wants to help. That's why I do this work. Not to scare you, not to overwhelm you, but to remind you that your health matters, your peace of mind matters, and you deserve to feel strong, capable, and in control for as many years as life gives you. So, let this be your starting point. Let this be the moment you stopped ignoring the signs and started taking action, because your prostate may be small, but the role it plays in your life is anything but. And when you take care of it, you're not just protecting an organ, you're protecting your sleep, your strength, your independence, your relationships, and your future. That's the truth, and it's one filled with hope. If you found this video helpful, please take a moment to like it. It lets me know this is the kind of content that matters to you. Share it with a friend, a brother, or any man over 60 who needs to hear this message. You never know whose life you might change just by passing it along. I also invite you to leave a comment below. Let me know what stood out to you or what questions you still have. I read every comment, and your feedback helps me create better content that truly serves your needs. And if you'd like to support this channel and help me keep making videos like this, consider making a small donation through the link in the description. Every bit helps. Morathon, you know? Thanks for being here, and more importantly, thanks for taking care of yourself. You deserve